Selamat pagi, good morning, welcome back to another Bali COVID-19 update. And this is December 29th, 2021. The year is almost over, and my name is Bruce. I'm wearing my glasses today because I'm filming early and it's very bright. And so in order for me to see the camera and the laptop, I need to have my glasses on. And first, thank you very much, Leanne, for the beautiful gift of the shirt and the shawl from my wife. I don't know how you picked the right size, but this is perfect. We really appreciate it. Thank you once again. And let's get on with the numbers. And the numbers are continuing to be excellent. And so 7-day average is still steady at 4. And the 7-day average for deaths, 0.4. So good numbers there. And what about Indonesia as a whole? Yesterday there were 278 new cases and 8 deaths. And what about testing? In Indonesia, 176,854 with a 0.18 positive rate. And the 7-day simple positivity rate was 0.11. So staying right on track there as well. And what about testing in Bali? Over the last 7 days, 45,850 tests were administered, and the positivity rate was 0.07. What about vaccinations in Bali? Bali, 3,490,687. That's 78.2% of the population. First dose. Second dose, 3,097,347. 69.3% of the population, and remember that's the total population, and we're still inching up to 70%. And yesterday, 5,218 additional doses, so way up from the other day. And yesterday, new cases in Bali, 5, deaths, 1, and active cases, 59. So what are the numbers like? The numbers are excellent. They're holding steady. And well, we're still in the holiday season, and so we're going to want to see what the numbers are like in another 2 weeks or so. But right now, looking good. So what do I call this? Optimistic? Pumped? Cautiously optimistically pumped. Still cautiously optimistically pumped. Well, you've probably heard about this already if you've been following the news at all in Indonesia. Well, the first locally transmitted case of the Omicron variant has been found. And so let's take a look at that. Indonesia's first Omicron community transmission case is man who visited Jakarta. And so the person in question, the person we'll be discussing, is from Medan. And he tested positive during a trip to Jakarta with his wife. 37-year-old man who so far has been asymptomatic and is currently being treated in a hospital in North Jakarta. The man in question tested positive for an antigen rapid test on December 19th and a PCR test on December 20th. He was then confirmed to be infected with the Omicron variant through a genome sequencing test on December 27th. And during that time, well, he visited a popular shopping mall in Jakarta, Central Business District, and he stayed at an apartment in North Jakarta. So he got around. And so he's had a lot of contacts. Do you think that that's going to make a difference? Yeah, probably. According to Dr. Nadia Termizi, he did a lot of activities prior to him testing PCR positive. We are conducting contact tracing now, 14 days going backwards from December 20th. We'll be testing the people who were at the restaurants he visited and at the apartment he stayed in. Okay, well, there's a lot of people that he could have come in contact with that they're not going to be able to test if the Omicron variant is as transmissible as everybody says it is, and it seems to be. We're going to have to take a look over the next week or so and see what's going to happen to cases in Jakarta. Are they going to skyrocket? Quite possibly, but no sense in panicking. And Indonesia so far, as of Wednesday morning, has 47 confirmed cases of the Omicron variant. And Dr. Nadia added, this first community transmission case has prompted us to tighten protocols for domestic travelers, as mobility would potentially lead to a case surge, especially ahead of the New Year break. She added, we have to make sure that all travelers using all modes of transportation are fully vaxxed and have a negative rapid antigen test. Okay, so we have the quarantine, the 10-day quarantine. Nobody likes it, but you have to go through it, and that's just the way it is. If you want to come to Indonesia, you've got the 10-day quarantine, and the government expects everybody to do it, but of course not everybody does. Government to tighten quarantine rules after Omicron patient flees, these idiots. So everybody that comes in internationally has to go through the 10-day quarantine. Well, unless you can get dispensation from the government, and I talked about that in the last video. Coordinating Minister Luhut said things are going to be tightened up because of the escapee. He said one of the patients had fled from the facility, but he declined to say who it is, which means it's probably somebody important. He said one person escaped and left with family members. I hope this does not happen again. So if this was nobody, well, you would give the person's name or at least their initials. So that's what leads me to think that this is an important person who's, well, what's that word that people use? Entitled. In regards to dispensation, Luhut said dispensation requests must be coupled with strong reasons like doctor recommendation, health, and other urgent matters, but there's a procedure that needs to be followed. And Jakarta is receiving about 4,000 people a day coming in from international flights, and I talked about in a previous video how they are expanding quarantine facilities because the ones that are here are just full. And Luhut said that the government is planning to open Juanda International Airport in Surabaya to accept international arrivals to ease the burden on Jakarta. Okay, why not Bali? I know a lot of people are going to say that. A lot of you are going to go, why don't we open up Bali? Okay, that's a valid question. Why not? I don't know. Maybe the governor will say something. Luhut said we have to open up another entry point because if the numbers of arrivals in Jakarta alone reach 6,000, the quarantine facilities will be congested. Okay, makes sense. So how's the government dealing with Omicron? Luhut asked regions to conduct testing, albeit zero COVID-19 cases. Luhut assessed the other day that there is a decrease in COVID-19 testing and tracing in a number of regions. And why is this? He said, well, he thinks it's because they've got zero cases. But he said we urge them to do testing because he said right now we have 46 cases of the Omicron virus in Indonesia, and many of them are OTG, asymptomatic cases, and so you don't know unless you test. He said the testing and tracing is necessary in order to help identify the cases that we do have and to stop a potential spread throughout Indonesia. So the government's really focused on not letting Omicron get out and around. And Luhut stressed, as everybody is stressing these days, do not travel abroad unless it is an emergency or urgent. Is that stopping people from traveling abroad? I hope so. And some more on Luhut and the Omicron threat. Government braces for international arrival peak in early 2022, preps scenario. So Luhut again said the government is going to continue to tighten up the entrance to the country by land, sea, and air in order to prevent any more spread of the Omicron variant. In addition to carrying on with the 10 or 14-day quarantine, depending on where you're coming from and who you are, the government has also prepared an anticipative scenario to deal with possible surge in international travelers. It's projected to begin next year. Well, next year is only a week away. And why is that? Well, because you have Chinese New Year coming up and you have Ramadan coming up. So Chinese New Year in February and Ramadan in April. And Luhut said, and this is related to the story about the guy running away, or the family running away, there should be no request for dispensation for trivial matters except for medication purposes or other critical matters. Luhut said that the stern measures that they're taking, I don't know, are they stern, to keep Omicron from spreading throughout the country have been successful so far, as seen by the low number of cases that we have, 46 as of now. And Luhut said that hospital admissions and death rates are also showing that the situation is under control. But he said we need to keep our eyes peeled. The monitoring of COVID-19 cases will continue down to the Regency and municipality level, and all elements of society should adhere to the health protocols. So far, in terms of what Luhut said, looking at the admissions and hospital admissions and the death rates and the testing, does that mean that Omicron has not gotten through and is out somewhere in the community spreading and people just don't know because, well, a lot of people are asymptomatic, or because the symptoms are less severe and people are passing it off as normal flu or cold? It's quite possible, but well, we're not going to know that for a while. And more from Luhut. He's been very busy. Remember, yesterday was Monday. Well, 2 days ago was Monday, and Luhut is often out giving his YouTube press conferences, announcements, and well, he didn't make the big announcement of increasing the quarantine to 14 days, but he had plenty of other things to say, and here's one of them. Micro lockdown a possibility if Omicron spreads broader. So Luhut said that if the Omicron variant spreads more broadly than it is right now, the government is ready to initiate micro lockdowns. He said the micro lockdowns, such as the one enacted at Wisma Atlet, which is where the quarantine is taking place right now, can be implemented in a broader area if local transmissions of the Omicron variant emerge. He said, I highly urge people to take notice of this. We shall not travel to other countries for vacation. It means we shouldn't travel to other countries for vacation, with the exception of urgent work-related matters that require us to travel, as he said and everybody else is saying, and I keep saying. Luhut added that the government has deployed personnel in a wide range of entry points to closely monitor the mobility of people from international travel. And quarantine proceedings are also tightly monitored to prevent future escapees from quarantine facilities. I'm laughing because this escapee stuff is, well, it's funny on the one hand and it's serious on the other. I mean, it's funny because, well, I still have the image of, little people running away from a big hospital and the giant government coming after them. On the other hand, boy, they're not being very community minded. They're being quarantined to make sure that they're not bringing the Omicron variant in here. And, well, they're self-centered, irresponsible people. So that's not the funny part. And Luhut remains optimistic that the Omicron variant will not spark another wave of COVID cases in Indonesia. He said it's been 164 days and cases have remained low since the peak of the Delta variant back in July. There's been no indication yet of an Omicron wave. And what about vaccines and vaccinations? Indonesia receives 9 million COVID-19 vaccine doses in a single day. All right. Where did these 9 million doses come from? They came from the U.S. and several European countries, and they arrived on Sunday. This was the biggest delivery of vaccines in a single day. All the vaccines came through the COVAX arrangement, and according to Health Ministry spokeswoman Siti Nadia Tarmizi, who we've often talked about, she said that the vaccines were transported in 4 cargo planes, including 1.42 million Moderna doses by France, 3.32 million doses from the U.S., 4.24 million doses of AstraZeneca from Germany and Greece. So according to the data as of right now, 53% of the target population has been fully vaxxed in Indonesia, equivalent to 110 million citizens, and 87% of registered healthcare workers have been given a booster shot. The government continues to inoculate children from the ages of 6 to 11, and that means that the target population is going to increase from the original 208 million, which was the target population. Out of Indonesia's 34 provinces, 9 have achieved a vaccination rate above the national average. Jakarta is the only province where 100% of the target population has been fully vaxxed, and Bali is second with 90.7%. And remember, those are based on target populations. In the last video for the wrap-up and the update, I just mentioned this situation in Singapore where kids were being separated from their parents and people were being forced to share a room with a stranger for quarantine. Well, the government had reacted to this. Omicron cases to recover at home community facilities as Singapore eases approach to managing COVID-19 variant. So you got some action from Singapore right away the next day after the story hit Bloomberg. Instead of being isolated in dedicated facilities by default, Omicron cases will be placed on home recovery or treated at community care facilities depending on their critical presentation, according to the Health Ministry. According to the Health Ministry, international evidence indicates that the Omicron variant is likely to be more transmissible but less severe, as we've talked about over and over, than the Delta variant, and that vaccines, especially boosters, remain substantial protection against hospitalization. According to a Health Ministry spokesperson, the adjustments in our approach to managing local Omicron cases will allow us to focus our healthcare resources on severe cases and protecting the vulnerable settings. This also allows us to go back to having a single, streamlined approach to manage COVID, regardless of the strains, which will facilitate operations on the ground and compliance to the protocols. According to the Ministry of Health, the Omicron variant's been found in 110 countries now, and Singapore expects a rapid doubling of cases because of the transmissibility of the variant. The Ministry of Health said locally the Omicron cases have not been severe. None have required intensive care or oxygen, although this may be partially due to most cases being fully vaccinated and from younger age groups. And according to this article, preliminary estimates from overseas studies also indicate that 2 doses of mRNA vaccines reduce the risk of symptomatic infection by about 35%. The risk is further reduced to 75% for individuals with primary and booster shots. And so they said it's important for us to continue with our booster vaccination program to enhance protection against infection and severe disease. So good news for people who are looking at that and going, wow, what is Singapore doing? Well, they've responded quickly, and hopefully the quarantine process will be taken care of in a better and more humane way. And here is a cautionary tale for those of you that are traveling. This is something to think about if you're going to travel and you don't need to. Danish family placed in isolation in Thailand after daughter tests positive for COVID-19. And so there's a Danish family. They went to Thailand for a nice family vacation, and they went through all the hoops. They studied up on what was required in Thailand. They had all of their tests. They had all their papers done. And they got to Thailand, and what happened? They went to the resort where they were waiting for the results of their test from the airport. And what happened? The test came back negative for mom and dad and positive for the daughter. And so Thai authorities came and they took the family for isolation at a local hospital. They took them in an ambulance. And at the hospital, they were greeted by staff in protective gear. And the mom and dad were allowed to share a room. But their daughter was separated from them and had to quarantine by herself. And she's 18 years old. Big enough to deal with that situation. But imagine that you are in a foreign country and you're suddenly put into isolation, don't speak the language, and you're separated from your parents. It can be a little spooky. It can be a little spooky for anybody, not just an 18-year-old, but especially for kids who don't necessarily have a lot of international experience. Well, mom and dad ended up free. They're negative, and Emily, the girl, is going to be in the hospital alone until the 31st of December at the earliest, where after 11 days in isolation, she will be allowed to leave. So this means that the family's vacation, okay, they're going to end up with 4 vacation days after all of this happened. And that during this time of isolation, the family tried to get a hold of the travel agency that had booked their trip for them, and well, they did, but the travel agency wasn't very helpful, and well, that's unfortunate. So that's another thing to think about. What travel agency are you using? How much can you depend on them? What are they going to do if you get put into isolation? And so this has been a very unpleasant experience for the family. And what's their advice to other Danes who are about to leave for Thailand? Stay at home, they said. They said, wait for the world to get better before you travel. Enjoy yourself at home so that you'll have a comfortable vacation. And so there's some good advice there. If you don't need to travel at this point, do you want to be stuck in a plane with people for, well, who knows how long? who may have the virus. And okay, let's say the virus is not as severe, effects are not as severe. A lot of people are asymptomatic. Older people, there's a question about how this is going to affect older people and people with other issues, weak immune systems. Whether or not it's severe, you get into a country, you get into Indonesia and you test positive, you're going to be at a government isolation facility at your own expense. So as I've said before, if it was me, and I'm a cautious person, well, sometimes cautious, I wouldn't be traveling right now. I would wait until this thing settles down. And what about Bali? Here is a story that I talked about, I don't know, a month ago, 2 months ago. And well, it's good news. Good news for those of us that live here, good news for Indonesians, good news for my daughter who's a nurse and wants to get a job. Bali International Hospital hoped to be Indonesia's Mayo Clinic. Jokowi. So President Jokowi was here in Bali to attend the groundbreaking ceremony for the construction of the Bali International Hospital in Denpasar. And this hospital is slated to be Indonesia's version of the Mayo Clinic in the U.S. And Pak Jokowi said he hoped that the International Standard Hospital will become the main preference for Indonesians who usually seek treatment overseas. Okay, that means government officials, that means rich people. And foreigners who live here who go overseas for treatment rather than getting it done locally. I've mentioned this before, but the treatment that I got here at Siloam when I had a stroke was much better than the treatment that I got in Singapore when I was medevaced out from my first stroke at Mount Elizabeth. I think it's Mount Elizabeth. I want to call it St. Elizabeth, but I think it's Mount Elizabeth. Much better treatment here. But according to government statistics, over 2 million Indonesians a year travel overseas to get treatment in healthcare facilities in Singapore, Malaysia, Japan, the U.S. And Pak Jokowi said, we lose about 97 trillion rupiahs because of this. 97 trillion. He said, this is why I'm highly appreciative of what's been initiated today. The Bali International Hospital is initiated by the state-owned enterprises Minister Erick Thohir and his team, and will prevent domestic options for those people who want high-quality health care. And the hospital, according to the president, partners with the Mayo Clinic in the U.S., the famous Mayo Clinic, and is expected to be completed and fully operational by 2023. Okay, let's get it done so my daughter can work there because, well, she's a highly skilled nurse and she speaks English. In case you're from a hospital and you're looking for a nurse, she's looking for a job right now. And good news for Bulalang. Again, yes, okay, some local news. One-stop service for elderly through Geriatric Polyclinic. Okay, if you are a geriatric person like me, you don't want to have to run from hospital to hospital, from doctor to doctor getting checked when you've got multiple problems. And with the BPJS, that's often what you have to do. You have to have a reference for each thing, and you need to see, for example, a heart care specialist and internal medicine and ophthalmologist, all sorts of different things. Because, you know, as we get older, hey, we start to fall apart just like an old car. Well, health services for the elderly are a priority for Bulalang Regency General Hospital, the RSUD. And for this reason, the Geriatric Polyclinic was established as an integrated services clinic for elderly patients. Yes, okay, good news. According to the main director for the hospital, the purpose for establishing the Geriatric Polyclinic is because elderly patients usually have more than one problem. And so if they needed health services, as I said, they had to go back and forth to a number of different polyclinics. And this is burdensome for us old folks, okay? We just don't want to have to do that. And so the elderly will be able to come to a one-stop shop. Yes, okay. Services of specialist doctors that are needed, they will come to them instead of the patient going to the doctor. Cool. And in addition, it also provides psychological counseling, therapy services, and nutritional backup to elderly patients who are undergoing medical treatment. at the Polyclinic. This is support for the patients so that their healing process can work more quickly. And in regards to how to get the geriatric polyclinic services, the director said it was not difficult for the elderly. He's coordinated with the Health Social Security Administration, that's the BPJS, to make regulations so that the elderly can be referred directly to the clinic without having to seek tiered referrals. And that is one of the big complaints about BPJS, is you have to have a different referral for each problem that you have. So he said, for example, there's an elderly person in a village who has a complex disease and then gets the benefits of first-level health facilities, both a health center and a family doctor. Then he immediately gets a referral to the Polyclinic. Pediatric clinic, the Polyclinic. He continued, the regulation is targeted to be completed in January next year. I'm hoping that's January next week. For now, it is still being discussed with BPJS. All right, I hope we're not going to have to wait another year. The opening hours for the Geriatric Polyclinic will be 8 to 2, Monday through Friday, and they're looking to expand that so that they will be operational on Saturday as well. So good news for old folks in Bulalang. And more on what's happening in Bali. You can see the high winds. You're watching this video. You can see them probably blowing around. You can see the waves behind me, I think. I hope if the video turns out good. I see zebra stripes on the sea here. Strong winds, fallen trees fall on motors, houses, and temples. I don't know what that overwrite is. And so extreme weather is still happening around the island, and extreme weather is going on everywhere. If you take a look at the terrible stuff that's going on, the situation in the Philippines right now, they're calling it extreme weather too, and they're saying that it's from the climate crisis in the world, the global climate crisis, and that they've always had these typhoons, but they're getting worse and worse. And well, the government here has said this many times as well, that the extreme weather conditions are getting worse. And well, is the world doing anything about the climate crisis? Not much. And so what about this story? Well, this story is really local. It's about cars falling on, it's about trees falling on houses and cars, fortunately no people, and destroying stuff. And in the last video I was talking about my neighbor who was repairing his roof because part of it blew off. And that is just a reality these days here with the wind conditions the way they are. And it's going to be a long rainy season. We're not even in January yet, and usually the worst doesn't come until February. So, I don't know. Bad weather, stormy weather. I would play Peggy Lee here, but I think that YouTube would catch that and put a little bad check on this video. Okay, time for a wrap up and update. And we do the update first. The update, for those of you new to this channel, are stories that have just come out this morning that I don't have time to go into in depth, and I may talk about them in greater length in the next video, and maybe not, depending on how they pan out over the next few days. And so what's the first one? Well, the government's been telling people not to travel unless absolutely necessary. And how is that working out? Over 10,000 Indonesians traveling abroad amid Omicron. So over the period from December 23rd to December 27th, 10,853 Indonesians left the country despite what the government said. Now, the government was asking them, they did not ban them, they asked them not to travel. But, well, 10,000 plus people needed to travel for one reason or another. It may have been a legitimate business trip. It may have been that they just felt like going on vacation. And out of all those Indonesians that are going overseas, despite the government's request, a number of them are going to come back with Omicron variant. And so that's not great news. Not great news for the government. And, well, they're going to be watching carefully, they said, with new arrivals coming in internationally. Is the government prepared? Well, 16,000 oxygen generators prepared to anticipate Omicron, says the Minister of Health, Minister Booty. And in addition to the 16,000 oxygen generators, there's 31 oxygen concentrators and more beds and medicines. So they are ramping up, getting ready in case there is a surge. Minister Booty stressed the importance of accelerating vaccinations, especially for the elderly and people with low immune systems, is necessary in order to protect them from the Omicron variant. And what about travel? Our tourism minister, Santiago Uno, sets a low target for foreign tourist arrivals for 2022, despite the upcoming G20 meetings. So Santiago Uno sets the target at somewhere between 1.8 and 3.6 million foreign tourists arriving in 2022. This target is lower than the number of people that actually arrived during 2020. In 2020, we had 4.05 million foreigners arrive. According to the deputy minister, the target is quite modest considering that the policy on border openings is still an obstacle. Okay, and so, well, the tourism ministry recognizes that policy is still a problem with foreigners coming into the country. And according to him, since leisure travelers cannot be counted on for next year, various international business agendas, or MICE, are going to be a major source of foreign arrivals and foreign cash. And he said if there's no more surges due to the Omicron variant, we will reach that number of foreign tourists, 1.8 to 3.6. More updates. Health Ministry prepares booster children vaccines in 2022, and so next year's national vaccine needs will include two programs. One is vaccination for children, and the second are booster shots. Okay, and that ends the update. And what about the wrap-up? Okay, first I want to mention the possible addition or probable addition of the Surabaya airport as a new arrival point so that people can be quarantined there. And I was saying, why not Bali? Well, that's wishful thinking. We're thinking in terms of getting some hotels filled up and maybe people coming in again to hang out after they do their quarantine here. But let's look at this logically. Most of the people coming in are Indonesians, and a lot of the people that are coming in that are Indonesians live in Java, the most populous place in Indonesia. And Surabaya is the second largest city in Indonesia, and it has a lot more facilities than Bali does. So makes sense to use Surabaya. 2022 is coming up. Are we hoping for a better 2022 than a 2021? Yes, we are. What's the good news on numbers? The news on numbers is it's great right now, and let's just hope it stays that way. And what about the Omicron variant? Okay, so far, Omicron variant seems to be milder. It's spreading rapidly everywhere in the world. Is it a problem for people that are older and who have not gotten booster shots? Yes, okay, it is. Are hospitals going to fill up? Yeah, most likely. That's happening around the world. Hospitals are filling up because of new cases. People aren't staying longer. They're staying shorter periods of time. They're not being forced to use oxygen, a lot of those people. But those are people that are vaccinated. Unvaccinated people are still a problem. And there's a lot of unvaccinated people in Indonesia, at least half the population. And so that's a situation, that's an issue for us. So when you think about this, try to get out of the mindset of Bali, and realize that Bali is part of Indonesia. And so we can't hold ourselves completely separate. Can there be some modifications made for Bali? That's one of the things that the government's been talking about, not using a one-size-fits-all program, and that would be nice to see. But at this point, there's a good chance that the Omicron variant is here, and we don't know how fast it will spread. Once it is here, we have a really high vaccination rate, as you've heard from the numbers. And booster-wise, no, we're not getting any boosters, and so we're going to have to see how that works out. Do we want to put a lot of pressure on the medical systems in Indonesia? No, we don't. The government's job is to protect its citizens, and it's trying to find a balance between health and the economy, and right now it's going for health as being given a priority. And that's their decision. That's not our decision, not my decision, it's not your decision. That's the government's decision. Whether we like it or not is really irrelevant. And I was interested in that, wow, there was a lot of response to the governor's 25,000 claim the other day. And well, yeah, you can be incredulous about it and you question it. Some people got there's some vitriol about this. I was surprised. This is a politician. He's got a job to do. His job is to try to keep people happy, keep the island running. And if you've been following this channel, you know that there's a lot of pressure on him coming from everywhere, coming from Jakarta and coming from local people in the tourism industry who want to open things up. And so, yeah, does he sound overly optimistic and maybe inflating numbers? Maybe, as I said, because there is an IT law, and I really am careful about the ITE law here. Are numbers inflated? Yeah, quite possibly. He's a politician. He's trying to keep everybody happy and keep things functioning the best he can. And so, yeah, give him a break. I make fun of this and make fun of the numbers of 20,000 and things. But is this the end of the world? Is he making some attack on people? No, he's just, really. I can understand the humor in this, and has he stuck them in his house? Yeah. Yeah, I mean, where are these people? Are we getting, I don't know, if we're getting 25,000 a day over, let's say, a week's period, well, how much is that? That's 175,000. Do we have 175,000 new tourists wandering around Bali? I don't know. We do have tourists here, okay, and so that's a good thing. That's a positive thing. The weather sucks. I mean, the weather really sucks. Everything here is wet again. I've got mold and mildew growing everywhere, trying to keep the stuff clean during this season. Okay, and what am I complaining about? I'm complaining about all the extra work I have to do because of the season. So some people ask me, should I come to Bali right now? Would I come to Bali right now? No. No, I would definitely not come to Bali right now if I wasn't here. Why wouldn't I come to Bali right now? Because of the weather, for one thing, because of a possibility that I test positive when I get into Jakarta or Manado or maybe Surabaya, and I end up in the hospital in quarantine, which I don't want to do. So yeah, there's just a lot of ifs. If the weather was great, well, yeah, it might be a different story. But the weather is not great right now. I would wait. I would wait until end of March, early April, when the weather clears and we know what's happening with the Omicron variant. And, well, what's the next variant going to be? Is the next variant going to be mild, or is it going to be another Delta? We don't know. That's just what I would do. And if you're coming for short term, certainly not. Why would you come for a short term and have to go through a 10-day quarantine? So I would sit tight, personally. I would really love to meet some of you that have commented here over I don't know, how long has it been that I've been doing these? I'll go back and look, and next time I'll tell you when the first one started. But it's been a long time, and so I appreciate all the comments. I appreciate subscriptions, and I appreciate the shirt lady, and thank you. If you found this video useful, I appreciate a thumbs up, and if you haven't subscribed, please consider subscribing. Comments are always welcome, but let's try to keep things positive. It's so easy to be negative. A new year is coming. I'm looking at things as positively as possible. If we take a look at this over the long term, we're in a much better place than we were 6 months ago, or a year ago, a year and a half ago when this thing started. I remember here, that was don't go out. The government offices were closed. We had no idea what was happening here at the time. Things still change rapidly. That's just the nature of the beast, not just in Indonesia, everywhere. I'm feeling optimistic. I'm still feeling optimistic. One of the reasons I'm feeling optimistic is because of the low death counts. That's it. New cases, okay, if we're going to get new cases with the Omicron variant, okay. If they're not serious, okay. We don't want that. I don't want that. But as long as people aren't dying, yeah. Domestic tourism is helping right now. It's going to slack off after the start of the year. And what do we got? We've got Chinese New Year. I said February before, but I heard that it's the end of January. So end of January, early February. We've got Chinese New Year, and then we have Ramadan coming up. And so, well, if you like being around during Ramadan, April will be a good time to come here. If you don't like being around Bali during Ramadan, you might want to wait until May when Lebaran comes and it's over. So that's it. Thanks for viewing. I'm going to try a new end screen today, I think. Be kind to someone today. Stay safe. And I'll see you on Wednesday. So that's it. I have no idea what day of the week this is. So that's it. Thanks for viewing. Be kind to someone today. Stay safe. And I will see you on Sunday.